Hello there. What's the difference between a psychologist and a psychiatrist? A psychologist can receive postgraduate training in psychology and obtain either a doctorate in psychology or even practice with a master's and a license based on the requirements of the country or the state they belong to. Psychology professionals have experience in clinical psychology or counseling practices. The title of a psychologist is mostly used by qualified people who've completed education training and based on state or country requirements have obtained a license. On the other hand, a psychiatrist is a physician trained in evaluation, diagnosis, treatment, and prevention of psychological or mental problems. Psychiatry is also divided into many areas, including geriatric psychiatry, that's elderly care, child and adolescent psychiatry, among other addictions and areas of mental health. The key differences between a psychologist and a psychiatrist are: one, the psychiatrist is a doctor, whereas a psychologist could be a doctorate holder, a PhD holder. Two, the academic preparation of a psychiatrist is greater than that of a psychologist. And third, the psychiatrist alone is authorized to prescribe drugs to patients who need them, whereas a psychologist could only resort to counseling and therapeutic approaches. As a psychotherapist myself, some of the approaches that I would utilize, leverage while dealing with my clients would be: one, CBT or cognitive behavioral therapy; two, psychoanalytic therapy; three, psychodynamic therapy; four, systemic and family psychotherapy; arts and play therapies; humanistic and integrative psychotherapies; hypnopsychotherapy; music therapy; experiential constructivist therapies, and even the egalitarian approach. When it comes to me as a person, as a psychotherapist, I would resort to using an integrated approach, combining some of these approaches, because every individual has a unique personality and a unique individuality, which is molded based on the unique background, the unique custom and practices that make up an individual. So one size fitting everybody approach would definitely not work, because we are dealing